Good afternoon, everybody. My name is Barry Hudson. I am the Director of Public Information for Montgomery County, and we'd like to welcome you to the weekly briefing from the County Executive. This week, we are joined by our regular group of professionals and experts, Dr. Earl Stoddard, who is the Assistant Chief Administrative Officer in the County Executive's Office, Dr. James Bridgers, who is the Acting Director of our Department of Health and Human Services, as well as Sean O'Donnell, who's the Acting Deputy Chief for Public Safety, Public Health Services. We're also joined today by Yvonne Iskandari, I think I said that correctly, who's in the Office of Eligibility and Support Services at our Department of Health and Human Services. Also, Dr. Chris Rogers, who's also here to answer some questions. Reporters, as you well know, if you've been with us before, just a couple of housekeeping pieces for you. If you would like, if you're still not connected and you'd like to record, please make sure you indicate so in the chat. If you have questions for any of our guests, you'll be able to do that by dropping something in the chat so we can recognize you accordingly. In addition to that, if you please also add your news organization, so we'll be able to do that as well. So if you don't have any, if there's nothing else, I will hand it over to the County Executive to kick things off. Mr. County Executive, how are you today?
I'm fine, and good afternoon, everybody, and thanks for joining me again. So this is National Teacher Appreciation Week, and on Monday, I visited the school where I taught 4th and 5th grade for 17 years. And that's Rolling Terrace Elementary School in Tacoma Park. And I really enjoyed my experience teaching in Montgomery County most days. I got into teaching because I wanted to make a difference, and it gave me the opportunity to do just that. And teaching requires measure of patience and dedication and passion. And it's a calling. You certainly don't go into teaching for the money. And I applaud all the professionals who devote their time and energy to give our young children the tools they need to be successful in school and also in life. During my visit at Rolling Terrace, not only did I get to visit my old school and see former coworkers, but I actually talked to a parent who was a former student of mine. She was dropping off her kids, and she recognized me at the front door there, and we had a little conversation. And many of my former students have actually stayed in the community, and I've been fortunate to have the opportunity to talk with a lot of them, and I learned a lot about their lives today. And it's interesting to see how they progressed from the time when I had them when they were 9 and 10 years old. Teacher Appreciation Week is about thanking teachers, and I'd also add all the non-teachers that serve our students as well for what they do for our children. And they're there for our students on good days and on difficult days. And I think we know that over the last few years, we've probably had more than our fair share of difficult days. Through all of this, they've been there for our kids, and I do appreciate them, and I know you do as well. That is also why I was comfortable making the difficult decision to raise the tax rate to address the needs of our students. Just give you a little background, since the recession of 2010, we've continued to not provide the schools with the resources they previously had. The county got permission, along with other counties in the state, to rebase after the recession. And rebasing meant instead of having to provide funding based on the previous year's enrollment and what we were providing the schools, and then adjusting it for inflation and for growth, we actually were allowed to rebase to a lower level. We never adjusted that. So as the recession ended, the county never went back and restored funding to what it had been before the recession hit us. And today, when you adjust for inflation, we're spending 80% of what we spent in 2010. We've not kept pace with salaries, staffing needs, or building needs. And our county used to be a leader in the state and region in funding education. We can't say that today. The tax increase is dedicated solely to MCPS. I've also proposed to the council a few ways to meet these needs, preserve needed services in our budgets and still potentially decrease that increase by 2 to 3 cents. However, we ultimately arrive at the funding plan. The fact remains that investing in our teachers and school staff is an investment in families and our communities. We owe our children the best education we can give them. That's why I continue to encourage the County Council to fully fund the budget request made by MCPS. Lastly, one of the dividends of adequately funding schools is that it protects our property values, because our school system has been one of the leading factors that motivate people to look, own, and rent in our county. So to the extent our school systems are successful, we all benefit. And to the extent that people perceive the school system as not being as successful as it once was, it's potentially puts our values in this county at risk. I want to thank Dr. Jessica Palladino and her team at Rolling Terrace for welcoming me back, as well as the wonderful students who I met and talked with. It was very encouraging to have conversations with these students. They asked a lot of questions, and it was interesting. And I hope everyone joins me in recognizing the amazing teachers that we have in Montgomery County. As we come out of the thick of the pandemic, we're still seeing too many families struggle with rising cost of food, rent, and other essentials. Part of this is because while we've had a job recovery, it has not been as extensive as many people would like. A lot of businesses that are in the service delivery area, whether it's restaurants or retail as well, either haven't restored their full hours or don't need the staffing they had pre-pandemic. And this has exacerbated the financial struggles that people in the county face. This is going to be potentially worse because the expanded eligibility that was provided during the pandemic for Medicaid is coming to an end. On top of that, the maximum monthly benefits for the SNAP program, which is a food program, ended on February 28th, 2023. At last count, there were more than 200,000 people in Montgomery County receiving Medicaid benefits. That's a little less than 1 out of every 5 people. It's a lot of people. This large number is the result of a decision by the federal administrators during the pandemic to keep everyone on Medicaid without requiring them to reapply. They did this because it was imperative to keep people healthy. With the COVID-19 federal emergency declaration ending tomorrow, all Medicaid recipients are going to have to go through a redetermination process, and some may lose their Medicaid coverage because they no longer qualify for Medicaid, but may qualify for private health plans or county safety net programs for the uninsured. And that's why we're working to reach out and inform Medicaid clients about the challenges or changes to the program for the last few months. We want every person potentially impacted by this unwinding to update their contact information in the state system so they can receive important correspondence from the state in a timely manner and know what steps they need to complete the redetermination process. In addition to Medicaid changes, there have been changes in the Supplemental Nutrition Assistance Program, or what's called SNAP. During the pandemic, all eligible households received the maximum allotment, and every recipient saw an increase in their monthly benefit amount. That supplemental benefit ended March 1st, and some households may also find they no longer qualify for SNAP benefits at all. This is putting an additional strain on family budgets. Data from April's Household Pulse Survey from the U.S. Census found that families earning between $50,000 and $75,000 a year saw a dramatic rise in food insecurity issues. Only 6% were impacted in March, but that has jumped now to 26% of households last month. The number of households receiving SNAP benefits in the county was around 35,000 as of March, which is about 5,000 cases more than they were seeing in 2019 before the pandemic. The county has launched an Office of Food System Resilience to help our departments and nonprofits focus on food insecurity, working together with them on these issues to help families struggling to keep food on the table. To find out more on how our county's Department of Health and Human Services is responding to these huge changes impacting families, I want to welcome Yvonne Iskandari, Administrator of DHHS's Office of Eligibility and Support Services. I'm going to ask her to update you on the county's efforts to assist families impacted by these changes, and then we'll take some questions for either myself or Yvonne. So I'm turning it over to Yvonne now.
Okay, good afternoon, and thank you, County Executive Elrich. I'm Yvonne Iskandari, Senior Administrator for the Office of Eligibility and Support Services at the Department of Health and Human Services. And yes, as a county executive has explained, we all know what was imminent is upon us. With the end of the public health emergency comes the unwinding of the Medicaid program. And a few months prior to this, we saw the end of the emergency allotment for our SNAP recipients. And so for us, this is something that has been in the works. It's something that we have been working on as a team within the Office of Eligibility and Support Services, along with our state partners at the Maryland Department of Health and the Maryland Department of Human Services. So as it relates to the Medicaid unwinding, we know that over 200,000 Montgomery County residents are on active Medicaid recipients. 50%, approximately 50% of those persons have been automatically renewed through the state, and that's a great thing. However, we still have another approximately 105,000 recipients who have to re-enroll. And what the state has done is staggered these re-enrollments, the redeterminations that have not happened over the past 3 years. And so folks are going to get notices from the state. They've already started getting notices, and they get these notices 60 days, 45 days before they are due. And as of the end of May, we would see the first set of people who have to renew their benefits. We locally have been contacting clients who have not automatically renewed. We started this effort since last month. We get the monthly ahead of the renewal, we get those updates from the state. And so we have been contacting residents, informing them about the renewal, assisting them with renewing, helping people to reset their passwords for those people who have no longer have or know their passwords. We've been helping them with that. We are seeing customers in our offices in person. We are assisting them virtually. We've set up virtual queues where we are able to assist them. We have the call center where people are calling and we are assisting them through this process. And so we anticipate getting the majority, if not all of our residents re-enrolled. And for people who may no longer qualify for Medicaid, they are transitioned to the private health insurance through the state, through the exchange, or they are able to participate in our county safety net programs. With regard to the SNAP benefits, the emergency allotments ended at the end of February, and we have worked with every customer who has reached out to us. We've gone through their cases with them. We've assured people what this means, and we do know that their benefits may have reduced. We've looked at assisting them with providing us with any of their expenses that may help them maximize their benefits amount. So if somebody's paying rent, if somebody has utility expenses, we are making sure all of those are updated so that they can maximize their benefits. In addition to that, we are also referring them to food resources within the county. We've done presentations at the Food Council, monthly Food Council meetings. They're assisting us as partners with helping customers understand what this means for them and what this benefit impact means. A lot of people have seen that, yes, their benefits are reduced, but assuring them that we've done everything to maximize their benefits has been helpful. And in addition to that, referring them to the resources in the county has also proved helpful.
Okay, thank you very much. Reporters, if you have questions specifically on this topic, which is a very important one, now's a good time to allow you to go ahead and ask a question specific to this. If you don't have a question specific to this, we'll move the questions, because there are a couple in the chat, to the next portion. Any questions regarding the topic we just discussed? Kate, Ryan, from WTOP, it's been a long time no see. Welcome back.
Thank you very much. I did want to know and clarify. So about 200,000 people have been on Medicaid. 100,000 of those have to re-enroll. Of that, how many will no longer qualify because of the changes to this program? Do we know?
Okay, really good question. And what we have are approximations, and that's because people's situations change. So from the data within the Maryland Health Connection that the state has revealed to us, we do know that approximately 210,000 Montgomery County residents are on Medicaid, and we do know about 50% have been auto-renewed. And what we also see from that system is about approximately 17,000 people that may lose Medicaid coverage. And that's not to say that they cannot transition into a qualified health plan or to a county safety net program.
Okay, and just again, so I understand that, those 17,000, why would they lose out? What changed that makes them no longer qualify for the Medicaid?
Okay, so there are several reasons that may make one no longer qualified. As we know, all of these programs are income-based programs. So if the income reported now shows that they are above the Medicaid threshold, they may lose Medicaid and may have to transition to a qualified private health insurance through the exchange. And also during the period of the public health emergency, where a number of requirements were waived, people may have been enrolled that are not qualified for the Medicaid program, somebody who is out of status, for example. And now that we are upon the recertifications, then you will see that those persons are no longer qualified. And so that person may be able to transition to a county safety net program. So these are some of the reasons why people may no longer qualify: income and out of status.
Got it. And briefly, and I appreciate this, if I'm one of those people who needs to re-enroll, what kind of documents do I want to have ready to go? What's the best and fastest thing to get me back in the program? And how many of these people are dealing with language barriers? I'm one of those people. You put a form in front of me and tears well up in my eyes. So,
Yes.
and I'm a native language speaker. I'm just thinking it's so much more complicated for other folks. What kind of assistance is available for that?
So first, with regard to what do they need to have up front, identification, so that we know you are who you say you are. And if there's income that you have and the number of people in your household, if it's in a household of one, that we know that you're a household of one, and we look at your income to be able to determine that. Understand that we see any and everyone because the state operates on an open door policy. So they don't have to be just Montgomery County residents. We see anyone that comes to our doors or call us regarding their Medicaid benefits. So identification, income are the two most important things. With regard to the second question on, I'm sorry, I lost the second question.
That's okay. Just basically is language barrier.
Oh, language barrier. Ha ha ha. Yes.
Issue.
So, as we well know, Montgomery County is the most diverse county in the state of Maryland, and we have staff representation to fulfill those needs. So, where we don't have staff that speaks a specific language, we are able to use the language line. So, we have our materials all translated in the 5 most common languages within the county. And so it's English, it's Spanish, it's French, it's Amharic, it's Vietnamese. So we have those readily. And in addition to that, we have staff complement of various, varying languages, where we are able to tap into those staff, and we are also able to use the language line. So definitely, and it's not just people who speak a different language, it's also people who may be illiterate even in their native language. So we are able to assist them as they call us or they walk into our offices, and we are able to work with them to ensure that their needs are met.
I'm glad you brought that up. I saw that as I taught. Last question, I promise. Can you tell me how to pronounce your last name properly?
My last name is pronounced Iskandari.
Perfect. Thank you very much.
You are welcome.
Okay, any more questions on this topic? Once, going twice, going 3 times. I want to thank you, Yvonne, for joining us, as well as Dr. Rogers. You all are welcome to leave now if you'd like, or you can stay along a little bit longer if you would like to.
Okay, thank you, and really appreciated being here to talk to the public. Thank you.
Okay, I'm going to hand it back over to you, Mr. County Executive, for the second half of the briefing.
Thank you. And Yvonne, thank you for joining us today. It's helpful, and I hope
Sure.
reporters are able to get this message out, because we're pulling out all stops to communicate with people, what's happening here. So thank you very much.
Yes, and I think one last thing to
Yeah.
that is, yes, we do want our reporters to also help send the message across, because as we try to reach people and people may have moved, change their phone numbers, we want any and everyone to assist us with spreading the message. So thank you very much for the opportunity.
Thank you.
Yes.
So on to other exciting things in the county. First, I want to talk about the council vote to raise the recordation tax. On Tuesday, the council voted to increase the recordation tax for higher priced homes and for certain refinancing. The recordation tax is only paid by homeowners buying a new home or refinancing an existing mortgage that increases the loan amount. So if you simply refinance to take advantage of a lower interest rate, which you actually wouldn't be doing right now, then it doesn't matter if your balance doesn't increase, you're not charged the recordation tax. Only applies to refinancing where you increase the borrowing, and only applies to the amount that you increased. If you're not relocating or changing the terms of your home loan, it won't impact you. This increase only affects home sales above $600,000, so it starts at $600,000. I supported this effort and I appreciated the council's work. However, I did want to point out that this move was necessitated because of an action taken by the previous council, an action that I did not support and that I actually vetoed. In the fall of 2020, the county passed Bill 3820, which reduced the impact taxes required by developers. Impact taxes are designed to help fund the infrastructure needed with new development. So we have taxes to fund both transportation and school needs, and they're based on new residential development in the county. Transportation is applied to all development. I've long said the impact tax process is not the best way to fund infrastructure needs because it requires developers to pay a large sum of money up front. And that adds to the financing costs. And it is one of the things that distinguishes us in a bad way, for example, from Northern Virginia. I've always supported restructuring how these taxes are paid, but I did not support removing the requirements that development pay its fair share for the necessary infrastructure without replacing it with a fair system. And losing these impact tax dollars has already, affected our capital budgets. And the action that this council took was necessary. The previous council that actually engineered the developer giveaway promised they were going to raise taxes to replace it. They didn't do it, and they left it to this council to do it. I'm grateful the council did it. The lost impact tax dollars already impacts our funding of school construction budgets. And this bill was needed to recover the lost funding stream. Had we done this earlier, we could have benefited already from a robust housing market and home refinance activity over the past several years. Now is the time for us to do it because we don't want to put our county at further risk and try to make this decision later. Obviously, activities not where it was before at this point in time, but the activity will increase as interest rates begin to decline. And we need to be in a position that as these activities increase, that we're able to take advantage of it. It is important, for capital funding. This year's school budget, once again, we were not able to fully fund the school system's needs. They brought in about a budget that was about 140 million over last year for the same period, which is mostly accounted for by inflation, and not able to build our schools that we need is a real problem for us. So this increase was necessary given the previous decision of the previous council. The current rates are going to remain in place for homes that are valued $600,000 or less. There's a scale of increases for houses of a higher value, with the highest rate for homes above $1 million. Money collected through this change would be split among capital improvements and emergency rental assistance. And this bill is about investing in ourselves and providing the funding that's necessary to make improvements that are long overdue and will enhance the quality of life for our residents, particularly, our school systems. So I appreciate the council taking action on this. While none of us are, enthusiastic about increasing any taxes, sometimes it becomes necessary. And this is why, I took our responsibility pretty seriously in terms of how we manage the request from the school system. I said this before, but it was an unprecedented $300 million request over last year. There was absolutely no way that would fit in the budget this year. We were prepared for a normal request from the school system. We were not prepared for this. We never would have been prepared for this. We don't increase our revenues by that much in a normal year. So this presented us with a real challenge. But the fact that school funding has not been restored to the levels of 2010, and I'll say a little bit more about that, is a problem for the school system. That's why I sent a memo to the council, though, urging them to follow our actuary's recommendation and use some of the OPEB trust fund. It's a benefit for retired employees, and it covers their healthcare costs. And we created the trust fund, but the purpose of the trust fund was to provide some or all of the costs for our county retirees. This fund has never been used to cover any of the costs for our county retirees. So over the past 5 years, it's grown from a little more than $300 million to over $750 million. So the fund is very healthy, and yet we don't use it to cover any of the current costs. And I think that's a mistake. It's now large enough that it can regularly generate an average over $50 million annually in investment return. According to our actuary's analysis, not only do we not need to add any funding this year, but we can actually withdraw funds from the trust fund. Currently, we don't withdraw any funds from the trust fund for county retirees. And all county retiree healthcare costs are paid through the general fund, which are people's tax dollars. So for you to just be clear about this, every year we pay the retiree health benefit out of your tax dollars. It's a straight out expenditure, like money for salaries, money for operations. That's just part of what's in our normal budget. In addition, we were funding the trust fund. This year, the actuary said not only do we not need to add any money to the trust fund, but we could reduce it by $17 million, given our current plan. So we've never really tapped into it. I think it's time for us to use the trust fund for its intended purpose. And that's why I suggested that we go into the trust fund for between, 1.5 cents, which would get us between $20 million and $30 million roughly, which would obviate about a penny to a penny and a half on the tax rate. So it would reduce the amount of taxes we would need, because we'd be able to take these tax dollars, which we're already collecting, and apply them to the school system rather than applying them to this trust fund. And doing this doesn't jeopardize the trust fund at all. If we withdraw this much and we made this a regular annual withdrawal of about, 1.5 cents of the tax rate, we would continue to collect more money than we withdraw. The fund would continue to increase, but it would provide a little bit of a buffer. And in this case, an important buffer in terms of the school system. More interestingly, or as interesting, and this, what we're doing doesn't make any sense because we're already letting the school system take the equivalent of about 1.5 pennies out of their OPEB, well, it's actually our OPEB trust fund, out of their portion of the OPEB fund, they're taking 1.5 pennies out to fund schools' ongoing school system costs. So the council on the one hand has approved it every year for the school system to do this, but is saying that if we do this for the county, it would be a terrible idea. It can't be both things. It can't be terrible for the county and great for the school system. If we followed what the county's logic is, we'd have to increase taxes 1.5 cents and stop the school system from tapping into the reserve account. Or the county could save 1.5 cents on the tax rate and do similar to what the school system's doing, pull out a little bit of that money to help buffer against the tax increase. So we sent a memo over to the council. We hope they'll consider it. To me, this is more sustainable than making cuts in the budget. I mean, it's unfortunate to see discussions about how much food support we're going to provide. Are we going to be able to fund the kind of training that we need? Are we going to be able to fund people that we're planning on hiring or hoping to hire to help us achieve our climate goals? There are a lot of cuts which none of us would want to make in a normal year, but we're looking at making this year, and it's just some of those cuts could be eliminated if we just look at using our resources a little bit better than we are today. I did support the council's decision to reduce most of the school system reserve account by the tax equivalent of about 1 cent. This makes a lot of sense, despite the school system's argument. The county government is the more or less guarantor of reserves for all agencies, including the school system. So if the school system would need to go into reserves, that's what the county reserves are for. And for them to have separate reserves just means there's another pile of money that sits there and may or may not be used. And that's not something we should be doing. We shouldn't be doing it in general, but we sure shouldn't be doing it now. So I was glad that the council took that action, but I think, taking these two things together adds up to at least a couple of cents that we could reduce the proposed tax rate by, still have an ongoing benefit and still help us meet the needs of the school system. So before I get to the health report, I want to point out that May is a number of special things happening right now. It's Building Safety Month again, and it's a special service we're providing this year is free deck inspections, and these inspections are very popular. Reservations for Department of Permitting Services free deck inspections are already over capacity. In fact, they filled up before the month was over. The department's also launched a new podcast series. The latest episode focused on deck and warning signs to watch for. I encourage you to check out the video on that. The other thing I'd say is that if you qualify for a deck inspection, if you can get a deck inspection, it doesn't matter whether you got a permit to build your deck or not. We're not looking for permit violations at this point. We're just looking to make sure your deck is safe. And we'd rather have you let us know that you want an inspection than not be sure whether your deck is safe. A lot of homeowners do the decks themselves, do it without a permit. It's good to know that whatever you did actually meets the requirements for building a safe deck. On Saturday, we have the opportunity to celebrate Montgomery History Day with a special ceremony up at Button Farm Living History Museum. For the past few weeks, it's been the home to a Harriet Tubman statue that the public can visit by appointment through the end of May. Saturday admission will be free as the farm marks Tubman's journey to Freedom Day from 10 a.m. to 3 p.m. The Underground Railroad hero helped many slaves find their freedom through Maryland. Historians will be on hand to discuss Tubman's life as a suffragette. And It's also a time for kids is being planned there as well. And I'm going to be present for a proclamation and to celebrate the life of one of our county's greatest heroes. And I hope to see some of you there. I also want to acknowledge that this is National Nurse Appreciation Week. And over the past few years, we've seen the tremendous work and sacrifices nurses have made. I want to remind everybody that these folks were on the front lines of taking care of people during COVID when we didn't have masks, we didn't have proper personal protective equipment, and we didn't have vaccines. They didn't decide that it wasn't safe for them to go to work and they were just going to stay home. They went and did their jobs and kept people safe and made themselves vulnerable in doing that. And they put their lives on the line for others so that everybody could be safe and healthy. And I think it's worthwhile for us to remember that and to thank them for their efforts during the pandemic. More lives were saved than lost, and we owe them a special thank you for all that they've done. And I particularly want to thank the nurses that work for Montgomery County in our schools and in our facilities, our health centers. I appreciate everything you've done and continue to do, and I just want to say thank you. And last but not least, I want to wish all the mothers, grandmothers, aunts, godmothers, and other special people a happy Mother's Day. And now on to the health update. In COVID-19 news, tomorrow will bring the end of the public health emergency that we've been in for more than 3 years now. While COVID is not completely gone as a threat, especially to many of our more vulnerable residents, we have effective testing and vaccines and therapies in place now. We didn't have these in the beginning. As we've mentioned over the last several weeks, Montgomery County is going to continue to offer free bivalent boosters at our community clinics. So if you're unable to get a booster, if you don't have a doctor, we are still a source of being able to get boosters. Outreach is also going to continue to help many people protect themselves with a shot. These vaccinations will continue to be covered by insurance when you visit a healthcare provider. But like other healthcare, you may need to be in network for this coverage to be supplied. So check with your healthcare provider or insurance for details. Free COVID tests and face masks are still available to the public at our local libraries, and face masks are still recommended for anybody experiencing COVID symptoms. I want to emphasize one thing about the vaccines that I want to make sure people understand. In the United States right now, COVID is the number 4 leading cause of death, number 4 in the country. Of all things on the list of leading causes of death, this leading cause can be dealt with by a shot. You can't say that about diabetes or heart disease or lung cancer or any of these other things. But you can say this about COVID. There is absolutely no reason for COVID to be the number 4 leading cause of death, except for the refusal of some people to get vaccinated. It's just sad and unnecessary for people and their families to go through this suffering when this is something that nobody really has to go through. So I hope if you're out there among those who are not getting vaccinated, as tempered as COVID seems right now, it's less tempered for the unvaccinated. And you are putting your health at risk and your life at risk. And I guess you got to ask yourself, is it really worth it? And is it worth it to your family to be doing this? So please think about getting the vaccine. It's for your benefit more than anybody else's. We've seen a rise in our case rate over the last 2 weeks. We've got this new variant that we're worried about, but it has not yet led to any kind of sizable increase in hospital visits. And our community level remains low. So that's good news. So right now I'm going to turn it over to Sean O'Donnell, who's our Public Health Emergency Response Manager. And he's going to go over our COVID numbers, and then we'll turn it back to you for questions. Thank you.
Thank you, Mr. County Executive. And again, as with previous weeks, this will be fairly brief. Just reminding that we're still looking at global COVID rates. This is from the World Health Organization, and they're showing in most places improvements in COVID transmission rates. Looking at the variants again, we see some of these subvariants of XBB continuing to creep into a higher percentage. Nothing dramatic over the last few weeks, and it has not caused a dramatic rise in cases. As the county executive just mentioned, over the last 2 weeks, we have seen some transmission rates go up in Montgomery County. We've been looking at some of the other counties. We haven't seen the rates go up quite to this extent here, but this is still far lower than we've been at many other points during this pandemic. And most importantly, we have not seen a significant increase in hospitalizations or hospital visits. Here's our daily emergency department patients in Montgomery County hospitals, point in time censuses, and you can see that has not gone up significantly. You can see here in the long chart, we've got a little bit of a rise in cases. But when we look at the inpatients at hospitals, that's been a minor increase. We have 6 more this week than what was reported at this point last week. 1 fewer in ICU, 7 more in acute care. So again, we haven't seen a significant rise in serious illness. We're still below the state threshold for this month of reporting the specific number of deaths related to COVID. They don't provide that specific number until it goes over 10, and we're still below 10 in May. Again, as our county executive has mentioned, we're still continuing a lot of the services that we have been providing. Those won't end tomorrow. One thing we are scaling back is the PCR testing that we're doing at county sites. We'll be giving out rapid tests in lieu of doing PCR testing there. And this is because the demand has really come down for PCR testing. It's very limited demand. And the standing up of the CDC program that allows people to find no-cost COVID testing throughout the community, a large number of pharmacies have enrolled in that. So individuals can go there and their insurance will either cover the testing, or if they don't have insurance, there will be no out-of-pocket costs. So again, we're publicizing that, but most of the available resources will continue. We do, just to again emphasize what was just stated, there are some changes with the end of the public health emergency related to who's covering what costs. We just ask individuals, vaccines are still covered by insurances, but just talk to your healthcare provider or talk to your insurer to find out the pathway to get that. Some other things, again, a lot of this is shifting over to the traditional insurance way of covering healthcare costs, as was done prior to COVID, or as has been done during COVID for other diseases. Those are all the updates I have at this point, and happy to ask our acting director if he has any additional comments, or if Dr. Stoddard has any additional comments.
Thank you, Mr. O'Donnell. No additional comments from me at this time.
All right, with that, we'll get ready to open the floor up for questions from reporters. Just for our viewers who are watching via the cable channel, in about 2 minutes, that broadcast will switch back over to the council session. You are welcome to join us on either YouTube or Facebook as this press briefing will continue. Going to the questions, we'll start off with Kate Ryan, who has questions for the county executive and other participants. Kate?
Thank you very much. I just wanted to clear up on the school funding issue to the county executive. Yeah. Bottom line, their contention that any reduction is not workable to their budget request. How do you respond to that? Are they asking for the right amount, or what do you think?
I've looked at their budget requests, and I'll say that most of it, the vast majority of this money is going to salaries, and I think that's 100% justifiable. In addition, I think there's about 50 million that was not directly salaries, but a bunch of those were like positions in ESOL, positions in mental health, the ability to try to provide more mental health services into the school system. So I think a lot of that is necessary. We could debate whether new programs or whether they've got other ways of funding some of the new programs, but that's not going to get you more than, maybe a few $1 million. You're not going to solve this tax problem. And I think just taking the approach of saying we're only going to fund this tranche of money or that tranche of money without knowing what you're going to cut is not a good way to do this. I don't want to put the school system in a situation where they can't, for example, hire teachers they need for special education, whether they can't fire teachers they need for ESOL, or they can't they can't hire social workers. So I agree with the council on the need for more accountability. The fact that I would say there's not a lot of accountability. If you were to talk about some of the issues that confront the school system, there's not been a lot of progress made. The achievement gap is one thing that comes to mind. And we need to have better discussions with the school system. We need more coordination between their budget and our budget. I think myself, but I also think council members need to have a better understanding of how programs work. I think we understand less about this than we do about our own internal budget. And yet this is half of the county's total budget. So there's a lot that I agree with the council in terms of what we need to ask for. Some of this may require state legislation, and I'm perfectly happy to support things that result in a more open process. But I think, the council should be careful on how it goes about doing cuts. That's why the money out of the reserves is a wholly different animal. They've had $25 million in reserves. They should have $0 in reserves. The council left them with $3 million. By the charter, the reserves for the county are the reserves for everybody. We don't have separate reserves for each department, and we weren't intended to have separate reserves for the school system. The school system's carved out its own reserves for reasons that escape me. I think it's something like, well, we don't know if you'll actually give us the money if we ask for it, so we want our own reserves. They may want it, but that's not the way the system's supposed to be set up. This is something they ought to trust us enough to know that, we want to support the schools, and if there's something that's necessary in the middle of the year and we've got reserves, we're going to help them fund it. But holding this money aside is not something they should do. And I fully support the council action to take back the 22 or 23 million that they took back.
Got it. Thank you very much.
Thank you, Kate. Also have a question from Sierra Fox from Fox 5 DC.
Hello, everyone. Happy Wednesday. Thanks for your time. My station wanted me to get on here and just ask County Executive Marc Elrich specifically, how do you feel about the current state of crime in Montgomery County? And then the second part is particularly what is being done in regards to carjackings.
So, I'm not happy about the current state of crime in Montgomery County. I don't know, that's almost like a rhetorical question. I think, there's too much, obviously, and in a lot of areas, it's an increase over where it had been in the past, but we're also totally not unique. And, we can give you statistics and compare increases in some of what we're seeing to what other people are seeing, and you get a perspective that the county is hardly the only jurisdiction experiencing this problem. We know that that COVID seems to have done a lot of severe damage to people's mental health. And we know there are a lot of people who are really struggling. And, our goal is, and you'll see it in Silver Spring, we have, increased every resource we can provide to try to be more effective at either preventing or stopping or catching people after they've committed crimes. And we are going to continue to do this. As long as the situation is what it is today, this is not like a temporary Band-Aid. We've put a lot of money into increasing the police force, and including, the $20,000 signing bonuses, assuming this all goes through the council, which I believe it will, to help us bring back the force, which is down about 120 or 130 people right now. That would certainly help us with staffing and coverage issues. I'll point out that, I raised this issue, I guess, 4 years ago in a budget and asked for an increase for the police department because we knew what was happening in terms of our salaries comparatively. And at that point, the council didn't support it. That's a different council. But we've known about this problem and have tried to address it. This council, I believe, is going to support the things we need to do in order to, preserve and attract people to come here to work. So we'll continue to put more bodies on the street and more technology in order to make things safer. And Earl, if you want to talk about any of the data specific, feel free.
Yeah, so the county council did their budget hearing for the police department yesterday, so we have some fresh numbers. So violent crime overall is up 7.2% quarter over quarter for the beginning of the year. But that's a mixed bag, as you alluded to. That's being almost entirely driven by a significant increase in carjackings. We're actually down in homicides, down in aggravated assaults, down in rape, down in commercial burglaries. So obviously we're seeing reductions in some spaces, but we're seeing a large increase in carjackings. We're also seeing increases in non-commercial burglaries and frankly weapons offenses. Weapons offenses, I think, is a big driver of our problem. There are too many firearms on our streets. That's a national problem that plays out mostly in our cities for reasons that I think we all understand from a national level. But the proliferation of firearms and privately manufactured firearms or ghost guns is a significant problem. The other thing we've also observed, particularly with carjackings, but also in other places, we're seeing a lot of youth-related violence. And that is a particular problem that I think, as county executive alluded to, is linked to the pandemic. We do have a youth harm initiative that we're focused on, not just youth violence, but also youth self-harm, drug abuse, fentanyl abuse, particularly working with our school system. I think that budget hearing is on Thursday morning. We've got a proposal for the county council to continue some of the work that we did that was very successful last summer. I will also say on carjacking, so it's one of those things where we're constantly evolving, and so we're up for over the year, but actually April was our lowest month for carjackings in months, and that's because there's been a concerted effort by the department to use technology, as the county executive alluded to, license plate readers, camera systems, and place officers in places using our violent crime information center in targeted locations aimed at preventing carjackings. Now, that's not to say that we don't need more officers in the street. That's a big part of this. But also, the use of that technology is going to be a big help for us. We just know that we need to coordinate with our regional partners, and that's what we're doing. As I think the DC is having their public safety summit today, so obviously this is something that the region is talking a lot about. And we have porous borders, meaning that people who may commit crimes in Montgomery County or in the district may not come from the district or from Montgomery County. They may come from any of the jurisdictions, and they often use that border as a mechanism to avoid capture. And so we need to work collaboratively, and that's what we're doing.
Thank you.
Okay. Do we have any additional questions from reporters? Kate Ryan, is that a hand up with an additional question?
Yes, I just wanted to go over the stat that Dr. Stoddard mentioned. When you said carjackings up, by how much was that? 7%?
No, violent crime overall is up 7.2%.
Okay.
But there are reductions, and they're ups. Things are up there. Now, carjackings are up a much significantly higher amount. I think we've had about 40 carjackings year to date as of the beginning of this, compared to about a dozen at the same time last year. So you can do the math on that. That's a significant percentage up. But the violent crime is coming down in other places, as I alluded to, and homicides are down, rape is down, commercial burglaries are down. So when we talk about it's a mixed bag, the carjackings are what are driving that 7.2 overall percentage increase. But again, it's mixed bag of other crimes that we're down in some areas and up in others.
Understood. And you mentioned youth. And is that specific to the carjackings? Yes.
A lot of our carjackings are conducted by persons under the age of 18. Those, they're often committed by people at 14, 15, 16 years old. Yes.
Got it. Thank you very much.
All right. Any additional questions? Going once, going twice, going 3 times. All right, that ends our session for today. We'll see you back here next week. And thank you very much for joining us. Any parting words, County Executive?
Just thank you for continuing to come here and talk to us, and we're always happy to answer questions, and look forward to seeing you all next week.
Thank you, and have a wonderful day, everyone.
Bye.